LSHTM has a long history of innovation in public health research. One important area is research into environmental conditions such as air pollution and respiratory health. If you go back to the 1950s, when air pollution in London was far worse than it is today, LSHTM led a groundbreaking study looking at the effect of that air pollution on respiratory conditions among civil servants. And what that study showed was that areas with frequent, thick, polluted fogs had a higher incidence of chronic bronchitis and deaths from respiratory conditions. If you fast forward 60 years, respiratory health problems are still a major issue both in the UK and globally. We published a study in 2018 looking at the effect of specific laboratory-confirmed respiratory infections on risk of heart attacks and strokes, and this study used large linked datasets from Scotland. What it showed was that having one of these confirmed respiratory infections was linked to a temporary increase in the risk of heart attacks and strokes over the next few days. This study is important because it's one of the first and one of the largest to really hone down on the particular respiratory organisms that can lead to cardiovascular complications. The take-home message for the public is that having a respiratory infection with one of these organisms can lead to other health problems as well, like heart attacks and strokes. That's why it's so important to have your influenza vaccine or your pneumococcal vaccine if you're in one of the groups recommended to do so.
My PhD is funded by the British Heart Foundation to look at vaccine-preventable infections and cardiovascular complications. We already know that people with pre-existing cardiovascular disease are at an increased risk of having a heart attack or a stroke following a respiratory infection, such as flu or pneumonia. Our research aims to look at whether other people, those without pre-existing cardiovascular disease, but maybe, for example, with raised blood pressure, also have this risk. If we identify risk, we can also look at whether vaccination within these groups could then prevent heart attacks or strokes from occurring. Assuming that we find vaccinations could avert cardiovascular complications, this would then lead to cost-effectiveness studies, and with the combined evidence could lead to extension of vaccine policy. By extending vaccine policy, we could potentially benefit the health of many people worldwide.